And we are back, baby! Did you miss us? It's only been 24 hours of separation, but I know how my heart was beating as we're counting down to live because I couldn't wait to come live and share news as always, gist and gossip, whatever you call it. That is what we do here. Anyways, welcome to the best daytime award-winning talk show happening on TV this year, if I do say so myself, and that is on Period. It's your favorite Gen Z baddie here to usher you in for a new episode of Just Series. So welcome, welcome one, welcome all to the best show on planet Earth. It's Woman Crush Wednesday, and you know I always have a question for the ladies. But today I'm channeling my grown woman, is it chakra? They call it, there's something they call it, chakra. Anyways, ladies.
I've been waiting.
I'm patiently waiting
I've just been patiently waiting.
That whatever these enthusiasm,
yes, we're here
and I know Catherine does not channel that much energy.
Energy on her seat.
Yes, what's going on?
It's a combination of both energies. Anyways, I have a quote for you ladies, and the quote is by Eleanor Roosevelt. You know who she was, right?
Yeah.
Okay, great. So, well, she once said, a woman is like a tea bag. You can't tell how strong she is until you put her in hot water. I love it so much. What do you ladies think?
I beg.
Eh?
No. Nobody should put me in hot water to know how much I can juice.
No, but
you know, a lot of times, I know that it's like something to celebrate the strength of women. But a lot of times, I think some of these things have made us go through the harshest of circumstances and things. Why do you have to test us this much to know how much we can give?
Like it or not, life tests
you. Do you put
you
men
know?
in hot water?
You know life tests you, right? Just remove men from the equation. Because I know most times when people hear that quote, they will say, oh, it has to do with men. No, but just remove men from the equation. If you put, you know, men and women side by side, I feel like women are stronger, like generally.
That one is on 100. It's on 100.
And so that's how you should visualize it.
Don't worry, I'll put you in a lot of hot water next week and for the rest of the month. So I want to see how resilient you can be. Please, there's nothing wrong with craving soft life.
Do you know what? I used to really like this quote, but after several years, seeing what people have gone through, seeing life situation, I prefer if life gives you lemons, you make lemonade. That's fine. But this one about this situation where it feels like you want to constantly test a woman's strength. People expect women to be able to take everything. And anything. I'm not superwoman anymore. I think that comes with growth and maturity. I remember, you know, I look back, you know, when Facebook brings you memories and you see some of your quotes, be like, no, my anything. I didn't know anything. I'll be saying things and be quoting with certain things.
The way I like to see it is, aside people testing you, life will test you. Your own biological setup will test you. Because remember there's this video that is circulating. I think it's been trending for a while, where a man will wear, you know, period,
but that's even simulation.
Yeah, so that's the idea. That's the idea. You have to go through that every month. It's not a man testing you. It's not your job testing you. It's your own biology testing you.
But if you can ask any woman, if you can ask any woman, nobody wants to be tested that much to show your resilience.
To reach into hot water.
Yes, hot water is hard.
It's very hard.
Do you know how many things women in the past have gone through that you'll be wondering that? And some of these sacrifices or expectations were unnecessary.
Yeah.
They could have gotten to that particular point without that much stress.
Yeah.
But because they believe that a woman is resilient, oh, you have to be a homemaker, a career woman. My dear, I didn't know this until some years ago. There's nothing wrong with soft life.
There's nothing wrong with if you can pay for certain things to be done for you, pay for it. There's nothing wrong in hiring people that make your life easy.
Then I would talk to my daughter and I would force her to go into the kitchen and try some domestic work. You know, one day she turned to me and said, Mommy, I really would do this because of you and because of, oh, I want it to be like I have the skills. He said, but Mommy, I do not see this as my future. He says, I'm going to live a very bougie and enjoyable, luxurious life.
After my own spirit.
I'm like, what's wrong with you? She said, Mommy, all these things you have to do for us, I'm going to pay to get them done. I don't have to do it. So I don't have to get my nails broken.
I love it. Leave it.
Let's quiet.
Let's leave it at that. Because
honestly,
this one will discuss this particular one. The quote. Hot water. They will put inside cup for you. But let's move on. Yes, it's not a curse, but as you said, life brings you different situations.
Yes.
Now moving on, it's really quite interesting that Blessings brought this up because in recent times there has just been too many cases of assault and physical abuse against women. Now, yesterday we looked at the controversy surrounding the arrest and detainment of 17-year-old Deborah Oshinowo. Lola also mentioned the assault on a teacher at Rosebud School here in Lagos. Now, that's a case we're following very closely, and we can tell you now that the parent involved has been arrested and the case transferred to Ikoyi. The teacher involved and the new Central Special Correspondent on Investigative Journalism covering the story will join us tomorrow with all the updates. So we're following some big stories.
I honestly cannot even wait for us to unleash that particular story because here on Jasiri, you know, we break what you don't hear outside. We give you original and authenticated, if I can say so myself. Anyway, this is a happy one and it's not even Friday. Nope. I wish we were talking about it on Friday, but it's Wednesday. I will just roll with it. We are not always happy with our government, and on all levels, in fact. But when they do something good, we should acknowledge. Now, it's time for us to give flowers to Tokunbo Wahab. I was like, okay.
Apologies.
Wahab, of the Lagos State Commissioner for Environment and Water Resources, and here is why. On Saturday, the 19th of October 2024, the Lagos State government arrested 5 individuals for obstructing traffic and creating an environmental nuisance during a birthday celebration on Raymond Njoku Road, Ikoyi. Among those arrested were the events planner, the celebrant, and the musician, the sound engineer, and the vendor. The suspects are said to be tried in court in line with the state's laws. The Lagos State government has reiterated its commitment to enforcing regulations and emphasized that no one is above the law, urging citizens to comply with the state's regulations and to avoid similar circumstances. Now I know, and I love a good Lagos party for the win any day. But I can't deny that the public nuisance has got to stop. I almost did like this. But you know that, we were talking before we came live, I was trying to remind Tolu of when it was like an everyday occurrence. But Tolu reminded me that it was during the government of Governor Fashola,
that he implemented it.
You might not know because you were in darkness then. Anybody can just wake up like this. Anyone can wake up in Lagos State
and put party on the road.
In the middle of a street. They would obstruct every traffic. They will have naming ceremonies, weddings in the center of the road.
And if you open your mouth and complain, they might even beat you on top.
Of course.
What?
But when that law came, that's one of the things that...
compliance and enforcement. People really thought he wouldn't go as far as he did. He did. He didn't care what level of government you were in, what level of society you were in. If you ran afoul of that law, Fashola's people were ready to come for you. And I love this because I need to ask, what is the audacity that you wake up with in the morning and say, you know what, that party I want to have, I don't want to go and pay for a hall, I don't want to do it in my house. This road that I know people pass every day is what I'm going to set up. And then the musician comes and doesn't say, Auntie, I can't set up here. The event planner doesn't come and say, Auntie, I can't do it for you here. The sound engineer does not come and say, Auntie, I can't do everybody.
Even around my compound, like, I wish they could just locate my compound, because sometimes before you get to my compound, especially when there's a church around there almost every Sunday, they leave their own church, then set the canopies in the middle of the road.
Report to the Lagos State Environment. I reported, and they have done something. It is one of the agencies that I've said, even before Tokunbo Wahab came in, I think Korede she was still a baby then, under a year old. I'll say it. I reported a church. How are you doing a vigil and your speakers are turned outside? If I want to come to the vigil, I will come to the vigil. If I'm not coming to the vigil, why am I hearing the vigil all night? I reported. They went to them, gave them warning, followed up with me, and I respect that agency. And now to see Tokunbo Wahab doing this, we need to get back to it. The lawlessness and the anyhowness and the audacity that many people wake up with in Lagos, it's staggering.
Yes, I honestly hope that this particular government will continue in this trajectory, because there's so many things that people do without care. It's just like throwing things into the gutters. I look at them every day, and I'm like, what is wrong with you? Even your common sense, you cannot see that this flooding in Lagos is a lot naturally. No, you will not contribute to it. Do you remember when people used to openly defecate?
Please, Lola, let's go to that, because just after what happened on the weekend, Tokunbo Ahab yesterday also shared about the environmental situation. I will say that if you're eating breakfast, you might want to turn away right now. It's a very sort of nasty pictures to look at. Now, staying with Tokunbo Ahab, the emergency flood abatement gang were also deployed or given deployment yesterday to clear the drainage system in Lagos Island. It was at Akambi Tom Joe, who drew the attention of the state to the canal on his X account, complaining about the poor drainage situation. He took pictures and tagged the commissioner to look into it. But can you imagine that Wahab replied that the EFAG team had already cleared the drainage twice this year already. They've cleared it twice this year already. And now they're going to do another round of cleaning, which will be done immediately. And we now have to put in place a monitoring and enforcement team that will be deployed to ensure continuous compliance to prevent any further blockages in the area.
Honestly, this is already commendable. They keep talking about these single-use plastics. Look at what we're using to clog our waterways. Styrofoam is there. You will see a lot of plastic PET bottles. You would see a lot of bottles. And is it that Lagos, or is it that people are not catching up with the world, where we are having environment sustainability projects that will make sure that you are not mixing your perishables with recyclable materials? And do you know that even when I buy groundnut these days, I will save the bottles, I will return it to where I bought the groundnuts from, so that maybe they can wash and reuse, instead of just throwing it in your bin and the thing just continues to...
You're even throwing it in the bin. You're driving in Lagos, whether it's out of their car, out of keke, out of a bus. You just see... You just see... It's a bottle,
pure water,
it's styrofoam, it's pure water.
We
then we will all come and sit down and start shouting about the government not doing its job. I think this is really, really a point where, as Nigerians, Lagosians in particular, we need to be retrospective. Because you think you're doing it in somebody else's neighborhood. The flooding that we've been seeing, with the change in climate change and the flooding we've been seeing, it can rain for 2 hours and Lagos is flooded these days. We all are going to have to be responsible. So imagine they've cleaned this place twice this year already. So who was putting it?
No, it's goals. You know that I like it. A lot of people say, Jasiri, I said, no, we're balanced on this table. When we see what is commendable, we'll talk about it. And when it's just like, if we see something wrong, we will talk about it in the same vein. So people, we need to regulate ourselves.
Absolutely.
There are some things that they don't need to feed us like children.
I think this has even gone beyond moral introspection or what. I think we need to double down on enforcing penalties for anybody that is
caught. Do you remember when they used to do this thing that if you cross the road,
jaywalking,
they'll make you do frog jump? And they'll still catch you.
I think that's Kai. So I think we need to update that. So I've been a personal advocate for community service. So this monitoring and enforcement stuff that Tokunbo Ahab is talking about, I don't think everybody needs to go to jail. I don't think everybody needs to go to court. If you're caught in the act, your day is finished. For that day, you owe Lagos State community service of maybe 5-6 hours. You also need to start cleaning. When you start missing meetings, you miss flights. You will have sense. You will have sense. I'm a big proponent of community service. I don't think everybody needs to go to a court, be jailed, and then we do back and forth. Let people start doing community service at the point of the commitment of the environmental crime.
And it will be so good that they give you a uniform. You know, there should be a one-size-fits-all overall where you get to do it, and you'll be your pictures will be taken, and they will even ask for your social media handle.
No, they should not wear uniform. That suit they are wearing, they should use the suit.
No, you know what I mean.
Because if you're wearing uniform, they'll think you're part of the workers. They should wear the suit with their shoe. No, wear your glasses. Don't remove anything.
Imagine if they now ask you for your social. Wait, is that what I just saw? No, tell you. Imagine they ask you for your social media handle, and they now collaborate with you and tag you. I say, this person on community service for throwing trash into the gutter.
No, they'll have like a pledge when they collaborate with you on Instagram. They'll say, I so promise never ever to do this thing over. It will be
Lagos State, if you do use this, please, you know what to do. You heard it first on this table.
Anyways, but on a serious note, guys, we really need to be introspective as a people. While government has its faults and has its part to play, so do we as a people. Imagine cleaning the canal twice already in 1 year, but it is in that state again. Who are the people clogging it? Lolo has already said ghosts. How do you put chairs and canopy on a road and set up a party without thinking of the people who who will be affected, we as Lagosians need to look inwards. It's when more people are made scapegoats that some people will get the message, they will have sense. But let's leave that now. After the break, the conversation shifts to a health focus. The UNICEF Nigeria Chief of Health joins us as we look at improving health outcomes for Nigerians. So you don't want to miss that? Stay with us.
Welcome back to the show. Please join the conversation across the various social media platforms. We are at News Central TV. Today, our focus is on the state of health of Nigerians. In December 2023, President Bola Tinubu put pen to paper on a far-reaching plan to overhaul Nigeria's health sector by upgrading physical infrastructure and equipment, retaining frontline health workers, and revamping the Basic Healthcare Provision Fund to improve access to essential services. There is a need for Nigeria to reduce its dependence on external aid while simultaneously boosting economic resilience. This shift is crucial to addressing the significant health challenges facing the nation. The truth is, the statistics are sobering. Nigeria has a maternal mortality rate of 576 deaths per 100,000 live births, an infant mortality rate of 74 deaths per 1,000 live births, a concerning under-5 mortality rate of 117 deaths per 1,000 live births. Additionally, neonatal mortality stands at 34 deaths per 1,000 live births. Alarmingly, UNICEF highlights that only 33% of children under 1 year old are fully vaccinated against major diseases.
Now, there are several issues that affect the health outcomes of Nigerians. Now, earlier this year, the Minister of Health and Social Welfare, Mohammed Pate, disclosed that about 16,000 doctors have left Nigeria in the past 5 years, and that all of us, over 200 million Nigerians, are just sharing some 55,000 licensed doctors. Don't get sick. According to the minister, Nigeria has about 300,000 health professionals, including doctors, nurses, midwives, pharmacists, laboratory scientists, and all of who make up our medical and health system. Now today, we're looking at the country's health challenges, especially in regions with vulnerable populations, and how we can improve the health outcomes for women, children, and families. Our guest is Dr. Eduardo Celades. He is the Chief of Health, UNICEF Nigeria. Dr. Celades, welcome to Jasiri.
Thank you. Thank you very much, Tolu and colleagues, for inviting me to the best show in planet Earth.
But you have to also tell them the other thing you said before we came. What about the vibe?
And this is fantastic vibes.
Thank you so much for joining us. I know we're laughing now, but entering this conversation is not a laughing matter.
It's not. It's not. And I want, for those that don't know, I wanted to start from here. There have been a lot of conversations recently on how to transform Nigeria's health landscape, and we're hearing about prioritizing local production. And there was recently an industry consultation held in Lagos, brought together by key stakeholders. So we're going to start from there. Dr. Celades, what's behind the push for local production, and what impact are we expecting it to have?
Okay, very good question. Thank you very much for that blessing. So just think that, for example, as UNICEF, we bring to the country every year more than 450 million doses of vaccines.
Wow.
They are sent by plane, like we get every 2 days, one shipment of vaccines, 450 million doses.
To Africa or to
Africa?
To Nigeria.
To Nigeria.
They arrive to Abuja only. Wow. Right, and then they're distributed to all Nigeria to vaccinate all our kids here, right? So imagine if this can be produced in Nigeria, right? We'll create employment, we'll create jobs, we'll create economic prosperity. It will be good for climate. Yeah. We are sending like planes like every other day with vaccines to the country. So of course it's not easy, right? This takes some time to have the quality, etc. But we as UNICEF, and we're seeing that from the Ministry of Health and the Presidential Initiative on Local Manufacturing, we think this is the right way to go, right? Why to do something outside when we can do it here? Exactly. We have a vibrant market here of pharma companies, etc. So this is a win-win for everyone. So we really hope to see this, maybe not next year, but in the 2 years from now, 3 years from now, I would love to see that happening in the country.
That's really interesting. I don't think many of us realize 450 million vaccines a year.
Yeah.
Correct.
Yet we have 33% of Nigerian children. We'll get to that vaccination conversation. But we shared some statistics during the introduction regarding Nigeria's maternal mortality rate, infant mortality rates, under 5 rates, and neonatal rates as well. But those are not the only numbers we need to be concerned with when it comes to health and Nigerians. When you look at the states of health of Nigerians, be it women, children, or families, what are we up against? What's the data on health in Nigeria?
So maybe let's unpack the data that you presented, right? Yes. Because I will see like there are 3 main pockets. One is in maternal mortality. You see it's 500 and something, but actually we don't really know. If you ask 2 different people on the statistics, they will tell you different numbers. 576, 1,000 and something. So with maternal mortality, we have an issue. We don't really know how many pregnant women. You were talking before about how resilient are women, right? Yes. How strong are women. But actually having a baby is something that women can die, right? In Nigeria, women die having babies.
Yes.
That's the reality. When they're very young, when they have many babies, they die. So for the first one, we need to really, what we're trying to do is to have one source of truth, right? To really know what is happening, because we really don't know.
Yeah.
When you look to under 5 mortality, we're seeing that the country it's moving. The pace, so the country is improving year after year, but not at enough. The pace is not enough. I mean, if we really want to save our children, what this number says is like 1 out of 10 children, 1 out of 10 are going to die before the age of 5. That's huge, right? This is one of the countries with highest under 5 mortality. We are moving. Why? Because we have more vaccines now, because we have primary healthcare is improving, but there's still a lot to do. Finally, when you look to the newborn mortality, that you put the statistic there, newborn is like the babies, right? 4 weeks, up to 4 weeks. No improvement at all in the last 40 years.
No improvement in neonatal, maternal death rates in the last 40 years in Nigeria.
That's correct, for newborns.
Oh my God.
Why is that? Because to do that, you need to really improve the system. You need to do a good referral system. The women need to go to the health facilities. Only half of the deliveries, half of the babies are born in health facilities.
Hospitals, And
we are talking that in Nigeria, we have 8 million new babies every year. That's massive, right? 8 million. So 4 million of them, they are born at home or at the community, whatever it is, right? So they are not safe, these babies. Then you need a good referral system. Then you need a good hospital to take care of the complicated cases. So no improvement in the next 40 years. So when we think on this, right, we need to really tailor what we are doing and how we are working a little bit.
Wow, Dr. Celades, that's like, it was like a punch in our face. Yes. In 40 years, we haven't seen improvement in neonatal deaths in the country. Mortality rate, I actually do know that it's because of a systemic failure when it comes to our healthcare system generally. So now I want to even limit it, or let's just say segment it. Because if you look at Nigeria, Nigeria is a large country. And we have a huge population. So sometimes we look at everything, as a country can really be mind-boggling. How about we look at it like regionally? Because every region in Nigeria seems to have differences and, things that set them apart or make them different. When it comes to health challenges in Nigeria or like in other places, if we're to break it down regionally, like maybe we're looking at the West, we're looking at the South or the Southeast or the Northeast, how is it like regionally? Are some places a little better than some regions?
So Lolo, you nailed down what is the problem here. That's fully correct. So inequities is a big problem, right? It's a big issue. Because when you look to the big picture, you can see a figure, but how this translates into the different states. So what we are seeing is like in the Northwest is so Sokoto and Kebbi especially, but as well Zamfara, they have some of the worst indicators in the country. For example, in Sokoto, only 1 out of 10 children, they have the vaccines that they need, 1 out of 10. Wow. Right? In some places in the Southeast, there is like almost 90%, right? So there is a huge inequity there, right? So we are seeing things like that. As well in the Northeast, they are slightly better, but as well, they are behind in many indicators. However, what we are seeing as well now is like even within the states, in the same state, there can be big differences, right? So just think maybe in Lagos, right? It's not the same in the island, in Banana Island, Victoria Island, that in Alimosho, let's say, right? So as well, we are seeing these inequities within their own states. Let's talk, for example, about zero-dose children. This is children that didn't get any vaccine at all, right? So Nigeria is the country in the world with more children that didn't get any vaccine. It's 2.1 million. Wow. And normally we think, all of them are in like rural areas, in Zamfara, in Jove, you think that it's up north, that in very inaccessible areas or insecure areas. But no, as well here in Lagos, right? we have like children that they have never been vaccinated, right? As well in Ogun. So we did a mapping actually of the 100 LGAs that we have more zero-door children. And one is in Lagos, one is in Ogun, the other is in the south as well. So sometimes we think this is only a problem in rural areas of poverty, but as well in urban areas, right? We have as well this problem. So you did the right question. It's like how we address these inequalities, how we are able to not only think, oh, we need to work in Sokoto, but how we look even in Lagos or even in rivers or cross river, and to really address that.
Okay, we're going to go for a quick timeout, and I think the information we're getting is a lot, not just from us, but also for people who are watching. But when we come back, we'll look at malnutrition, we'll also look at vaccine hesitancy, we'll also look at the alarming global statistic that has come out about the rise in HIV in adolescent girls worldwide. This is a conversation you don't want to miss. Our guest is still with us. We'll continue after this.
Thanks for staying with us. It's still Jasiri, and if you've been with us from the start, you know how important the conversation we're having is. We're still talking about health in Nigeria, and we have our guest, Dr. Eduardo Celades, the Chief of Health, UNICEF Nigeria, still with us, and he's been giving us some insights into the health sector in Nigeria, especially when it comes to the rate, the mortality rate, neonatal in Nigeria. And I just want to ask Dr. Eduardo, as the Chief of Health, UNICEF Nigeria, what barriers have you seen to achieving equitable access to good health care in the country? What are the barriers that we experience?
Thank you. Very good question. So I think there are two main barriers. And you guys mentioned one earlier in the conversation, that there are only, like, let's say 55,000 doctors in Nigeria, right? But they are not equally distributed. Right? Most of them are in Lagos, maybe in Ogun, or Abuja. But it's difficult to attract doctors to very rural areas. So one of the main barriers that we are seeing is like weak primary healthcare systems. What I mean by weak is it means like there is not enough doctors, nurses, midwives, the data is poor, maybe the cold chain or the supply chain is weak, right? As well, we don't have good financing. So to us, the main barrier is a weak primary healthcare system, right? We really need, you mentioned as well that there is a plan to upgrade 8,000 primary healthcare facilities in the country. We as UNICEF, we are contributing to more than 500. Right? So we think that's very important to have a very strong primary health care, because when you get sick, the first thing that you do is to go to the primary health care that is closest to you, right? The second barrier, of course, is as well issues with access and transport, and what we are seeing is like the indicators are worst if you live very far away from a primary health care facility. So access could be insecurity, could be poverty that you cannot pay, to go there. So as well, this is the second thing that we are seeing. So we're trying to address that. We are like really quite excited with the plans from Mohamed Ali Pateh from the Ministry of Health with the sector-wide approach, where it's bringing all the partners and it's mobilizing resources to strengthen primary health care to crush maternal mortality. So we hope that we'll see progress in the next few years, but still we are in that road, right?
Absolutely. We need that progress. So let's talk about malnutrition now. It's one of the big issues that UNICEF focuses on. Now, data from UNICEF shows that malnutrition is a direct or underlying cause of 45% of all deaths of under 5 children in Nigeria. 45%. I think I need to repeat that for the weight of that to sink in. Malnutrition is a direct or underlying cause of 45% of all deaths of under 5 children in this country. We also have the second highest burden of stunted children in the world, with a national prevalence rate of 32% of children under 5. Dr. Celades, it's disturbing, it's alarming. I'm having goosebumps because I'm thinking of the lives of these children who end up dying because of the issue of malnutrition. What is the impact of malnutrition in children that can follow them into adulthood if it doesn't kill them before they turn 5?
All right. So, look, Tolo, I have been in Nigeria 3 years already, and this is the worst year that I think.
The worst year?
Regarding malnutrition.
Is that tied to the economic situation in particular, or what do you think?
Likely it's tied to that, right? So we are seeing like an increase in poverty, so the affordability of the bag of rice now is much more expensive. So we are seeing that very strongly in the Northeast, as well in the Northwest, but as well in urban areas like Lagos. So malnutrition is not only a problem of the Northeast. When we are looking to the data, we support a lot of treatment centers with RUTF. RUTF is like a ready-to-use food, right? Like it's like a package, you eat it, and the child can get the calories and the proteins that they need. We are seeing like the data is showing that almost double, right, the needs of RUTF that we have in the country. Good thing for RUTF, all the production is produced locally. So we are purchasing this locally in the local manufacturing that we were talking at the beginning. But anyway, what happens with a child is malnourished when it's wasting is like, of course, it's much more vulnerable to any disease.
Yeah.
For example, even if you vaccinate the child against polio or measles, maybe the vaccine will not work, right? Because the child is really malnourished.
Wow.
It will mean that it's much more vulnerable to any disease, right? It's much easier if it gets cholera or measles, it will die. So really, to us, it's very, very important to address that. Not only for children, but as well for the pregnant women. And maybe, Tolo, you remember when you got pregnant, maybe 9 years ago, you were getting like the iron and the folic acid.
Yes.
Yeah.
Now we're trying to introduce in the country, jointly with the Ministry of Health, MMS. This is micronutrients, right? That have all the zinc and like all the vitamins. So that will be as well a great way to improve the maternal nutrition. So when the baby is born, has already like a good foundation in its body.
Oh, this is a lot.
You know, when I'm looking, I'm struggling, I'm listening to the statistics, and it's really burdensome for me. And I know that UNICEF is doing a lot to support us in Nigeria, but we cannot take away what what we are supposed to do as a country. What can Nigeria do to change this situation? Imagine if we were not getting aid from UNICEF. What can we as a country do? Because these statistics that we're throwing about, it's life. It might be statistics on paper, but these are flesh and blood people that are going through this particular, that form the data that we're talking about. What can Nigeria do as a people to just improve, or maybe in our localities or local government areas before it moves into the bigger circles?
Look, I'm optimistic in what Nigeria is doing. I am very happy to see that the vision that the Minister of Health, Mohamed Ali Pate, he has for the health sector, right? So he's trying to upgrade and having fully functional 17,000 primary healthcare facilities all across the country. So that's the vision, and we're following that vision, right? So we as UNICEF, we're contributing to that, but as well, he's getting the resources from the budget, from the World Bank, from others to make that happen. So I really think that this can have an impact, right? And this is completely led by Nigeria, by the government of Nigeria. So I think we're in the right track, and the priority is to crash maternal mortality. So we are very happy with that. What the population can do as well. So one part is to make accountable as well the government, right, and the health facilities. So now we are looking how the communities and the civil society can make accountable the health facilities. For example, with patient surveys, like quality of service, right? Because it's not enough having a primary health care. You need to have services with quality. If you are mistreated, people will not come back, right?
Medicines.
Yeah, and finally, if you think like on the people, like in us as members of the community, I think something very important, and maybe we'll talk about that, it's vaccines and immunization, right? Yeah. Vaccines work, they are safe, they are effective, but we really need to pass that message in our communities, to the people that we care, that we love, right? Because if not, vaccines are the most effective tool to reduce infant mortality. We know that it works.
And we're going to go deeper. I said there's a vaccine hesitancy, I guess, trend, I think, that we've noticed in the West, but it's also seeping into some African countries. We'll touch on that. But I want to go to something that was said at a recent event to commemorate the International Day of the Girl Child. And it was the chief of the UNICEF Field Office for Southwest Nigeria who disclosed that a staggering 75% of new HIV infections among adolescents globally occur in girls. But I want us to domesticate and localize that conversation to Nigeria. So when it comes to HIV/AIDS, what is the status of things in Nigeria?
So Nigeria is one of the countries with more HIV because of the population, right? Almost 2 million people in Nigeria have HIV, 1.8 million, right? And this is about 1.3% of the population. So it's a good, it's like a number. It's a number, right? So you mentioned, so what is happening now? So the epidemic is shifting, right? And now what we know, including Nigeria, is that young girls have twice the possibility of getting HIV than young boys, right? So young girls, because of one is physiology, right? So because young girls is physiology, but as well for the relationship with older men, etc. So now what we are seeing is like a growing number of infection of HIV among young girls. And this is a message that they have for young girls, for the parents, etc. Right? So don't forget that this exists, right? Now we tend to forget these days, not so much the HIV conversation, but it's still happening. And we're seeing that in Nigeria. So 33% in Nigeria, 1 out of 3 of the infections are among young people. people from 15 to 24 years.
Wow.
New HIV/AIDS infection.
AIDS infection.
Wow.
It's not like older people or older men that they're having sex with, whatever. No, it's really like younger people. So this is an appeal to young people to really think, right, and to really take
Responsibility.
responsibility, right? Don't forget that HIV is still there.
Yeah.
Don't forget that there's still a lot of infections in Nigeria, and don't forget that you are a young girl or you are a young boy. You're at risk of HIV more than at this moment.
And it's sad because, you know, on social media, you see people deliberately spreading these things. Like, there was a video I saw where a guy came out and like, if only all the girls he slept with this week knew that he was HIV positive. So it's like there's a deliberate attempt to spread it across.
I'm even beginning to think, because I know that a couple of years ago, I would want to say that Nigeria was very forceful about the campaigning, the messaging, when it comes to HIV campaigns. We had things like Know Your Status. You know, it was very aggressive at the time. What would you say is missing now? Is it that is it the change of government that has happened that has, you know, doused some things that we consider important, or is it our strategy that is lacking, or we no longer have implementation, or we have just completely forgotten about HIV/AIDS? What would you say is
and has any
missing?
progress been made at all in Nigeria? Even if we see these numbers, have we been progressive in addressing it and making sure that people who have it are getting their retrovirals, are getting help medically, are on a register, and we're able to track?
So Nigeria has been progressive. So Nigeria has been doing the homework, right? Okay. So we are seeing, we have support from PEPFAR, from the American government, from the Global Fund, strong leadership on NACA and NASCAP. So things are there. I think there's two factors. One is like now people perceive that HIV is more a chronic disease, right? So it's not like you're not going to die.
It's not a death
sentence. It's not a death sentence any longer.
Remember, like 20 years ago, it's like, oh, I am going to die.
Yeah.
So people know that. Finally, that message to respond to stigma and discrimination is there, and it's true. Right, so there's like a sense of less fear to the HIV, right, and more relaxed on how, you know, how we interact and how we have sex and other things. That's one, and the second one, the second factor as well is like there are so many things happening, right, in the health space. We have cholera outbreaks. We are seeing
now we have monkeypox.
Monkeypox.
We just battled COVID.
COVID. So people are just overwhelmed. They're saying, what is happening here, right? So many things are happening at the same time. Where I put my attention, you're telling me to vaccinate against COVID, and pox, Lassa fever, Ebola, right? So many things. So it's difficult really to keep the attention of people. People are lost with so much information, plus the misinformation that we are seeing.
Wow.
Okay. So the chief of the UNICEF field office of Southwest Nigeria has highlighted that the number of adolescent girls not engaged in education, employment, or training, 1 in 4 is nearly double that of boys. And she also revealed that 1 in 5 young women aged 20 to 24 are married as children, while nearly 1 in 4 partnered or married adolescent girls have experienced sexual or physical abuse. My question is, what is the impact of this status I just read out, or this data, and the situation on health outcome for girls and women, particularly in Nigeria?
You're fully right. We are very concerned with that. There are states in Nigeria where 1 out of 2 young girls already had a baby.
1 out of 2. That's basically 50. Just 50%.
It's 49% in some states in the north.
Have already had a baby at what age?
So sorry.
At what age typically?
Before 18 years old. This is so. This is a big concern, right? Why? Because the body of the woman is not ready yet. And you were talking about this resilience and how women are strong. But I mean, the reality is your body is still shaping, right? It's not ready for that. So it's much more likely that you will have a newborn mortality, that even maternal mortality, that you will not have access to adequate care. So for us, like even you are at risk of HIV, you will not have enough the antenatal post checks, all these kind of things. So really for us, and this adolescent health is something that I have to, maybe you ask me, my main failure after 3 years in Nigeria has been yet to have a big program to address adolescent health issues. Why is that? We have been focused as UNICEF so much in under 5, in the newborn mortality, trying to improve those indicators, right? Because children are dying, like 1 out of 10, as we said. So we neglected like adolescent girls, mental health issues, pregnancies. So I think we need to shift that. I think like moving forward, adolescent health, trying to address that, addressing like early marriage, addressing like teenage pregnancy, addressing unemployment, addressing leaving early the school, I think that should be our priority moving forward. We need to think on the future, how Nigeria is going to be in 10 years. I hope in 10 years, we'll change indicators on newborn mortality, maternal mortality, but adolescent health, I think we need to start to work on that.
Wow.
It's interesting you termed it, if you would think about your failures in 3 years. And I feel that it feels like it's a weight you're carrying in terms of adolescent health, particularly for girls. But let's look at a statistic we shared earlier, and that was about vaccines, because I know there's a big conversation here. So UNICEF reports that only 33% of children under 1 year old in Nigeria, under 1 year old are fully vaccinated against major diseases in Nigeria. And there has been an increase in vaccine hesitancy in the country, but also we've seen that around the world. So Dr. Celades, why do you think we continue to struggle with vaccination? Yes, there might be a regional conversation to be had, a state-by-state conversation, and I like it. It may not be good, but it was important that you pointed out that even Lagos suffers from a lack of vaccination of all children as well. So it's not just a northern problem, which is what we tend to make the vaccination conversation in Nigeria. So why do you think we continue to struggle with the vaccination rates for our children? And what does the data tell us about what happens to children who are not vaccinated?
Okay, let me start with the good news, because it's not only our problem. 3 years ago, when I arrived here, the things have changed since then, right? So 3 years ago, we didn't have rotavirus vaccine, rota, right, to prevent diarrhea, right? We didn't have as well HPV, right, human papillomavirus vaccine. Now we have that for young girls 9 to 13 years old. And we didn't have malaria vaccine. And you know that malaria vaccine arrived to the country last week. So we're going to have the first doses, and we can talk about that. So this is really exciting. This is the good news. Now we have more vaccines to protect us against more diseases. That's the good thing. The bad thing, what is happening? First, big inequalities. We are missing every year 2.1 million children with no vaccine. Wow. Right? And as I said, some of them are in rural areas, other ones are here in urban areas. We are missing that. To me, that's my main priority for this year. We are working with MPHCDA and the Federal Ministry of Health to do something that we call the big catch-up. We want to catch up these children, these boys and girls that we missed over the last few years. We want to go to the last community to find them and to really be able to vaccinate them against measles, etc. So that's something that is not working. The other one is the growing vaccine hesitance. Vaccines acceptance is going down.
Yes.
We saw that here in Lagos. In Lagos, so HPV vaccination last year and this year was a global success. Nigeria vaccinated more than 12 million girls against HPV. This is huge. This is something incredible. However, in Lagos, we had like more than 500,000 vaccines that were not used for girls, showing that it's a growing issue here in Lagos, right? For misinformation, mistrust. And sometimes I try to reflect on that, right? When we were kids at our time, or when I was a kid, and maybe we got only very few vaccines. Remember, they were like maybe 6 vaccines, maybe, and they were there for forever. They were there. Like our parents got the same vaccine. But now, in the last 10 years, a lot of vaccines have been created. And developed, right? And then COVID came, so people started to wonder what is happening here. Before, nobody was discussing that vaccine. I mean, it was you had a baby,
just accept it.
You just vaccinate, of course. What you are going to do, right? Now things are more complex. We have social media, Twitter or X, Facebook, Instagram. Pushback, everybody giving their own opinion. We are doing social media monitoring to see where the conversation is going. And sometimes it's going south, it's not going to the right direction. People without no medical background, they start to give opinions. Right? So we really need to respond to that. Good news, maybe if you guys are around on this Thursday, we're going to launch a new song on vaccination and immunization. We have invited like 11 singers from all across West Africa. We have as well stars from here, from Nigeria, Waje, Cobhams, and others. And you remember, we are the world.
So this is our own version.
We are trying, and it's going to be here in Lagos.
I love that advocacy.
That the advocacy work in Lagos is moving forward. This is the largest urban conglomerate in Africa. So we cannot succeed on immunization if we don't succeed in Lagos.
Wow. I'm looking forward to that.
But
just because time is running off, you know, we see the global crisis. Honestly, the world has seen a lot in the past couple of years, from pandemics to conflicts, and some of these times,
which is it's also part of the conversation.
It does exacerbate the health challenges, especially for children. They're the most vulnerable. And as UNICEF looks towards the future, what are some of the emerging health issues that need urgent attention. I know the one that is dear to your heart, adolescent girls' health. What are some of these other, health issues that we need to really put our focus on? Like HIV now, before it was, but now everybody's just like,
what should we prepare
quiet.
for?
What should we prepare for, really?
Very, very good question. Let me I have three, and we already discussed two. I think that the big three things that I'm trying to work with my team and to be prepared for the future are three issues. One is adolescent health. Half of the population is going to be adolescent. Nigeria is going to be, I think, the third country, the third
one
largest.
Of the top 5, Shah.
Yeah, one of the top 5 countries in the world,
yes.
in 20 years from now. Yeah. So one is adolescent health. We need to be working on that. The second one, we mentioned that as well, is local manufacturing. We cannot depend on other countries sending us vaccines. Like Mpox, for example, we get 10,000 vaccines. Now maybe we'll get 30,000, but we cannot depend on donations, right? We need to have our own capacity. Nigeria needs to have their own capacity. But the third one, you mentioned that, is climate change. The impacts of climate change. That's key. You are seeing that in the floods. This year we had floods in Jigawa, the floods in Maiduguri. You know that when the floods in Maiduguri, the water was so high that came into the cold store, into the fridges with the vaccines, and destroyed like more than 1 million doses of vaccines.
Wow.
So this impact of the floods, of the climate change, is going to affect us massively. So we're actually working with the government to try to make the health facilities more climate resilient. So they are protected against floods, earthquakes, etc. But as well, we have heat waves. We have climate change.
Yeah.
So we are going to see how the seasons, the malaria season, the cholera season, the meningitis season, it's getting expanded. Before it used to be only like few months, meningitis that is on the belt in the north. Now we are seeing that goes like
and then they'll now start overlapping.
Correct.
Yeah.
Because before meningitis used to be December to maybe February, March. Now we are seeing it starts in November and ends in April. Wow. Right? The same cholera. It's almost like all the year around we have cholera cases, right? So we're going to see how we have more diseases, that they are more time, and that outbreaks are more frequent and more severe.
Wow.
So climate change to me is a big issue moving forward. But as well, we're not ready yet. Nobody's ready, right? So we need to set now the foundation so we are ready when this really happens, right? It's already happening. When it gets really bad, in a few years, we're really ready for that. Wow. Still, I'm optimistic. I think Nigeria is in the right way. Yeah. But still, many challenges ahead.
Absolutely. Wow. This has been an absolutely amazing conversation, and we look forward to having you back as well. Dr. Eduardo Celades, he's the Chief of Health, UNICEF Nigeria. Thank you so much for joining us, looking at improving the health outcomes for Nigerians. It's work in progress. Some success, some progress, incremental as it may be, but it's good to hear that there is progress, but we also need to focus on the areas that progress has not been made and what is coming ahead of us. On behalf of the ladies and of course our guests, we'll say a very big thank you for joining us. Don't forget, tomorrow we take on the altercation at Rosebud School. The teacher will be joining us, as well as News Central's special investigative journalist. We'll be breaking down that entire story right here on Jasiri. 10 a.m. West African time is the date. Do have a good day. Bye for now.
Bye.